The proxy war that is set to transform public health in America is about far more than just vaccines. At its core, this conflict revolves around deep questions of trust, personal freedom, and the government's role in managing public health. What was once a largely bipartisan agreement on childhood immunizations has now evolved into a fierce struggle involving the federal government, state authorities, and the medical community. Central to this upheaval is a dramatic policy shift led by U.S. Health Secretary Robert S. Kennedy Jr. Under his leadership, long-standing vaccine recommendations have been rolled back and advisory committees have been restructured to include more vaccine skeptics. This move has sparked a sharp ideological divide among states. Florida is moving toward eliminating all vaccine mandates, while California, Oregon, and Washington have banded together to form a health alliance aimed at protecting these mandates. The Western states felt compelled to take action after the abrupt dismissal of the head of the agency responsible for disease prevention. This firing sent shockwaves through the public health community and raised serious concerns about the direction of health policy. "You're putting Americans' health at risk," declared Democratic Senator Elizabeth Warren during a tense hearing on Capitol Hill. She was addressing Secretary Kennedy directly, referencing the recent firing of Susan Monterez, who had been in her role for less than a month before being removed. "She didn't bow to pressure, so you fired her," Warren said, emphasizing the gravity of the situation. "You are endangering the health of American babies, seniors, and all citizens. You should step down." Senator Raphael Warnock echoed these concerns, calling the health secretary a hazard to the health of the American people. He pointed out a troubling resurgence of measles deaths among children, something unseen in the past 20 years, and attributed this alarming trend to Kennedy's tenure. In response, Kennedy criticized the Centers for Disease Control and Prevention, CDC, stating that the United States had performed worse than any country in the world in managing COVID-19 deaths. He accused CDC officials of imposing harmful policies, such as mask mandates on children and school closures, and noted that many of those officials would soon be leaving their positions. This ongoing turmoil has led to a fractured public health system where vaccine access and regulations vary dramatically depending on the state. The fallout has been so severe that several senior CDC officials resigned following Monterez's dismissal. Adding fuel to the fire, Florida's Surgeon General Joseph Ladapo compared vaccine mandates to slavery, arguing that the government has no authority to impose such requirements. "Your body is a gift from God," he said, "and what you choose to put into it is a matter of your personal relationship with your body and your faith." This battle is essentially a tug of war between collective responsibility and individual choice, a conflict that will ultimately redefine the future of public health in America. But here's where it gets controversial. Should public health policies prioritize individual freedoms even if it risks community safety? Or is it the government's duty to enforce measures that protect the many, even if it means limiting personal choice? What do you think? Is this new direction in public health a necessary correction or a dangerous step backward? Share your thoughts and join the conversation below.